Without further ado, Shane, welcome to the show.
Oh, thanks for having me, Ed. Good to be back.
It's always good to have you back. One thing that we talk kind of offline, we always seem to have those discussions offline when it comes to healthcare and things like that. But you mentioned some things that were really interesting. One, you talked about the combination of Berkshire Hathaway, Amazon, and whoever else, like in this case, J.P. Morgan, with regard to what they were doing in healthcare. You also talked about some of the things that brought forward and some of the problems that were created or all things that people were trying to not necessarily happen when it comes to those sorts of things. So let's open it up with that, Shane. Let's talk about the state of healthcare right now at the level that you're at, in addition to where you think it's going, let's say, in the very near future.
Yeah. Well, I think it's really interesting right now. It's exciting times. The announcement with J.P. Morgan, Berkshire Hathaway, and Amazon, where they're really going to focus their efforts on addressing healthcare. You know, healthcare spend is really the number two cost in an employer's P&L right now. I mean, next to employee salaries. So, but they typically have somebody that is not a non-finance person managing those benefits. And so, what I think what's happening is they're going to find that this is a huge quandary right now that's going to take a lot of time and effort. But the good news is, I think you're seeing a lot more tech getting involved, like looking at Lyft and Uber and making their announcements that they're joining in on the healthcare side of it now. And so it'll be interesting to see what the incumbent health insurance companies are going to do with these new groups coming in to try to help us get out of the hole that we've dug. You talk about what they want to do. Historically, if when we were with Employer Direct, we had a large corporation that was looking to use our products, and one of the large insurers said, if you guys go with these guys, we're not going to work with you.
Sounds pretty anti-competitive, right?
Yeah, I mean, and it's one of those things where you look at it. What's best for the employer? What's best for the employees? Is that going to cut into their bottom line? Not at all. But it's going to cut into the employees' bottom line. And so, yeah, it's interesting. It'll be to see what's going to happen over the next couple of years with these guys coming in.
Well, you mentioned Uber and Lyft. Kind of dig a little bit deeper into what they're doing as far as healthcare is concerned. Yeah.
So, really, one of the when I worked with the VA, one of our biggest issues was actually getting patients to the appointments and coming in for surgery. And so what Uber and Lyft are doing is they're partnering with healthcare plans to where they can automatically schedule these the appointment to pick them up and get them to their medical appointments and then get them back home. And we underestimate the issue with some people and transportation, and so I think it's really interesting to see how they're integrating with new with health plans and health plans like ours that to make it easier and simpler to get health care.
Well, they should definitely call the Dallas City Council, because they actually debated this Tuesday for almost an hour and a half. It took them that long to figure out how to get people to a particular type of appointment when it came to the need for health care, especially in this case for seniors. So it's interesting that you take that kind of bureaucracy and you can talk about it, and all of a sudden you have Uber and Lyft and saying, we can do this. So I guess going forward, and here's the $64,000 question when it comes to health care. Do you see the bureaucracy and our inability to turn around the Titanic potentially moving toward what a lot of people are really interested in looking for, is, other than yours truly, a single-payer system? Do you see at some point we may just push it to the limit where people actually get what they want?
Yeah, I think you're going to end up seeing that in the next, probably 10 years. But just remember, Canada and England, which they're basically the prime example of a single-payer system, really aren't single-payer systems. If you look, their employers still have private insurance for their employees. So I think you are going to see that. It's going to take...
Or some version of it?
Or some version of it. You already have Medicare in place, which is
exactly what they try to do. I always try to figure out why Medicare and Medicaid existed, and we had to come back with something different, which we won't mention here. As far as new health care is concerned, we already had kind of a plan that did essentially the same thing.
Yeah, and I think the infrastructure is there. the pricing models. I think one of the things that I really like about Medicare is the fact that all of the pricing structure is there, and that's one of the things that really is a huge issue in healthcare itself. Is you don't know how much you're paying.
No,
right? I mean the transparency is not there, but at least with Medicare, you know exactly what you're paying and how you're going to get paid, and it's a fair system. And they pay. Actually, if you look, Medicare is one of the fastest payers, believe it or not. It's about the only thing the government does fast, but
well, they don't have a disincentive not to pay you like some insurance companies do. So obviously they'll stretch out a claim as long as they possibly can. And looking at Medicare and looking at the different things that are out there, what would you think would be a way in which the government or employers could try to make this more efficient? Because we know what you do, but we also know what they do. And for whatever reason, it seems the two don't seem to match sometimes.
Yeah, I think the first thing that they can do is actually get somebody that has the financial training and awareness to run the benefits program. I think that's first and foremost. The second thing is, like, if you look at what Apple's doing, they're hiring their own primary care physician group for their employees. But what's more important is they have coordinators that are actually coordinating the care. And I think that's the biggest challenge you see today is the coordination of care is, people go to an emergency room for a sniffle, and they don't realize, because of that lack of transparency, what it's going to cost. And
$8,000?
I think the average in the state of Texas on the Texas report last year was $6,500 was the average. Yep. So it's, for something that if you went to an urgent care is going to cost you maybe $150. So I think that that's the change that you're going to see. And I think there's employers that are already starting down that path, and I think the pain point is finally there. I mean, Lord knows why it took this long, but it took this long, and now we're kind of at a critical mode where a time where we need to do something. Otherwise, we're not going to be able to give raises. Period.
When you think of we just saw what happened to a couple of groups. We saw what happened to Target's earnings day as a result of that. When you think about the coordination and the coordinated effort to get people in to actually have treatments, do you see that as one of the ways when you can prevent certain things down the road and be more proactive in healthcare management versus allowing something to fester for, I don't know, who knows how long? The next thing you know, you got to have surgery and it costs $100,000.
Yeah, absolutely. I think that's the key. Is one of the challenges today is that people put off their care. So they don't want to go in and have a $400 bill. They don't want to pay, a $5,000 deductible. And so by putting that off, a simple sinus infection could turn into something a lot more serious where you need hospitalization.
So it could be like Peyton Manning, just rub some dirt on it.
Right.
And you mentioned last time in your last visit, you talked about the fact that the majority of people who filed for bankruptcy and had money issues, the number's right around $500. So obviously this is a way to alleviate some of that, isn't it?
Absolutely. I think that if you're able to go get the care and know comfortably that it's a $25 copay or it's just a certain copay, you're going to get the care. And at 62% is what the number is. 62% of personal bankruptcies in America actually are caused by medical-related
you thought I wasn't listening last time, right?
I know, exactly.
Well, Shane, we're about out of time for this particular segment. How can people find Hooray? We know you do great things, but how can people find Hooray on the internet?
HoorayHealthcare.com. 3 clicks and you can get health insurance.
Perfect. Again, it's Ed Baxter sitting in for Michael Yorba. We'll be right back with the Private Equity Spotlight. This segment was brought to you by the Vitamin Patch.